Good morning and welcome to our second NASA BOCES Spotlight webinar. Today's session will highlight our use of personal protective equipment in special education programs to reduce worker injuries and keep staff in the classroom and on the job. Today's presenters are Angela Guptill-Nagle from PERMA, the Public Employer Risk Management Association, our workers' compensation insurance provider, and Matt Zegers, principal of the NASA BOCES Rosemary Kennedy School. Matt and Angela.
Good morning.
Good morning.
Okay.
And Angela, you're good to start.
All right. Thank you.
Good morning. So my name is Angela Nagle. I'm a school risk management specialist with PERMA. I was a former superintendent of schools and director of special education. As a risk manager for PERMA, we provide consultation to our members, one of which is NASA BOCES.
Good morning. My name is Matthew Zegers, the proud principal of the Rosemary Kennedy School. We are the fortunate recipients of some of the products you'll hear about today and the benefits that we have received in keeping our staff safe and feeling secure while they do their due diligence in working with our students. So we're going to get right into it. Go to the next slide.
So PERMA is the largest pool provider of municipal workers' compensation coverage in New York State. We provide workers' compensation coverage to school districts, BOCES, towns, villages, police departments, and fire departments throughout New York State. I'm the school risk management specialist, so I work specifically with schools that are our members and BOCES, providing risk interventions to lower workers' compensation claims. And in the process, as we're going to discuss in a few minutes, we have a lot of added benefits to reducing workers' compensation claims through our interventions.
Absolutely. Next slide.
Sorry, somehow it skipped ahead. Here you go.
There we go. Okay, so the Rosemary Kennedy School, a little bit about my program. Our program services students from ages 10 to 21 with a variety of developmental disabilities. They are listed up on the screen. Our classes are primarily consisted of 612, 6 students to 1 teacher, 2 teacher aides. However, the ratio goes very much higher up because of the levels of needs of our students, including the need of one-to-one aides. So in our rooms, there are a lot of people. And with that dynamic creates a lot of challenges that go along with it. Our students have universal challenges in terms of management needs. Some of their behaviors they exhibit include physical aggression, which lead to some unfortunate injuries in the room. So our job is to explore ways to keep everybody safe, address the students' needs, and to ensure that they are promoting a sound learning environment. So the program consists of about 320 students, about 280 of them in our center-based program. We have them also in our partnering districts for other reasons. Total number of staff, as you can see, is 300, which is well warranted for the levels of needs. As I said before, the essence of what we do is to provide a safe and supportive working environment and learning environment for all, facilitating great independent skills so they can make contributions to their home communities when they exit us. Our practices consist of specially designed instruction, physical layouts, and different dynamics, so that this way the students have everything they need to be accessible at all times.
When you look at worker injuries in a school setting, 66% of all claims are caused by interactions with students, and in particular, students with special needs. So Matt and I collaborate together, taking a look at workers' compensation claims and then matching that with interventions. And we've been very successful in reducing the number of staff injuries at Rosemary Kennedy schools and in other sites where we've implemented this innovative approach to school safety.
Yeah, couldn't agree more. It's been a great partnership so far, and it's really taken note within the staff and their ability to recognize that they feel supported by administration, by PERMA, and by Nassau BOCES by recognizing this need.
So PERMA's RISE program, Reducing Injuries in Special Education, takes a detailed examination of workers' compensation claims. So in working with Matt, I can drill down on his data and know exactly what type of body part is being injured, how frequently a staff member is injured, and then match that type of injury to an intervention to all but at least reduce, if not eliminate, claims in that area. So it's a very targeted risk management program. I've come in, I've worked with staff, provided professional development. We've got staff buy-in, we have union buy-in. The staff have been extremely enthusiastic. And one of the great things we've seen is we've actually seen the staff now taking responsibility for their own safety and coming to Matt and I with solutions, which is just really amazing to see, in addition to seeing workers' compensation claims being reduced, so Matt and the administrative team can spend their time on what they really should be spending on instruction, the curriculum and other things, instead of working on, accident reports. So I come in as that support person to work on reducing those injuries and providing solutions.
Absolutely. And as Angela said, it's the data that drives it. It's the data that drives the conversation. It's the conversations we have with the employees, making them aware of their options and having them reflect upon their professional practices and advocate for themselves. And again, building that professional culture really supports the reduced claims as well. Okay, so some of the items that we have been piloting here are the result of the behaviors that we are seeing. So I'm not sure if you can see us here. We have them all laid out. I'm going to see right here.
Super.
Go ahead. So we'll start.
Yeah, these are scratch gloves. So with some of the smaller students, or if you're working with a student that's constantly breaking the skin through scratching, these are scratch sleeves. They're extremely comfortable, extremely breathable. They go on underneath the clothes, all the way up the arm. The student cannot provide a scratch, cannot break the skin.
Another piece of equipment is an arm guard. So for students that have a little bit more biting tendencies, it simply slides over the sleeve. As you can see, I have a suit on, easily comes right over. And in addition to that, we also have these gloves, very well supported, if you can see in the camera. Extra layer of protection. Students then cannot penetrate them. Staff's hands feel safe, secure, easily goes on, just as simple as 1, 2, 3.
You see a lot of students that like to bite the fingers or pick at the skin. This prevents that. We have several types of gloves. We have a glove that is touch sensitive. Staff do not need to take it off if the student has a Dynavox or if they're working on a smart board or on a cell phone. It will operate all of those electronic devices with it on. If you have a student that scratches and bites, you can see I've layered this up. So that prevents both types of injuries.
In addition to that, we also have for the legs, if we have some kickers, we also have shin guards that simply go on the legs, prevent the lower extremities from getting hurt. Some other things that we have explored, the most sensitive being head trauma that we have seen, concussions, certainly are leading to the most amount of time away from work. So what we have been exploring is the use of mouth guards to prevent the whiplash and the teeth clenching down on each other when struck. Simply goes in. Excuse me one sec, that was the wrong side. I piloted both because we did upper and lower. As you can see, it doesn't really impede too much on your ability to articulate and speak. But at the same time, you can still get your verbal directives out and support the students through that crisis at that time.
And if you are taking a hit to a head by the student, that is going to prevent you from biting your tongue,
Yes.
from biting your lip,
Mhm.
and quite possibly receiving that concussion. Those are tailor-made. A company comes in, scans the employee's head, and that is theirs that fits customized into the employee's mouth. All of these are provided to the employees based on the students they're working with and the types of behaviors that are presented by the student. So it's very, very tailored.
Yeah, one last thing, just to show over here, we have a jacket that goes over that as well to protect the whole body. Inside, you would see there's padding that is put into it. The padding in itself, very reinforcing so that this way the student can't get any trauma to the body. To the staff member, they wear that, prevents any bodily harm as well. So what we do want to note is that all of this is individual to the employee. There's no sharing. It is given to them. It is their property. We go over with them. They take pride in it. They maintain it and ensure that they have it. Just as if you were going to a construction site, you would wear a hard hat to make sure that you are safe and secure. When working with challenging students, we make sure we have the gear so that this way we are prepared and secure as well. Okay, want to go back to the presentation?
And one of the best ways to really take a look at this, in a minute, we're going to show you a short video right now of the use of PPE right here at Rosemary Kennedy School.
Hi, I'm Anne-Marie Mann. I've been with BOCES for a little over 30 years, and I'm here to let you know that you can teach an old dog new tricks. Not only am I a bus matron, a teacher's aide, and a support team member, I am also the CSCA president. So thanks to PERMA, we have a bunch of items to show you how you can dress for success for every situation. Here we have students with developmental disabilities. So we have an arm guard that went from just a scratch to an arm guard that, because sometimes a student may have the potential to bite. We have everything there for dressing for success to help that student and to help the person working with that student. Okay, so now we have the arm guards, and now here the hand protection. Okay, everything is interchangeable, and you can work over and with everything that you're wearing, and total movement. You're not restricted in your movement in any way, nor is the student going to be restricted in any way. Everything is a custom size and a fit, and it's all individual. Nothing will be shared. Every member that is working with a student will have their own very customized gear to dress for success. So one of the good things that we have with the glove that we're able to manipulate and work with the student, I can access anything still wearing the glove, okay, without and use this and have the student show me what they want and still be protective. If I have to hook somebody up in this and I know that they can potentially bite me, I don't ever want to lean over. Okay, now if I have to put my arm or hand into a situation, okay, to unbuckle or to buckle up a student that has the potential, I'm protected.
Okay, so in response to the pilot program that we've done, we have collected information based on their perception on a couple of poignant questions. For example, what was the feedback from the staff? Can you tell us how you feel and if you wanted to keep you safe? So again, a lot of them were not sure in the beginning about how the responses was going to take, as you can see, and whether they wanted it, because unfortunately it is a barrier that you're going to have to recognize that in an educational environment, you may not think that you need this equipment. And that perception of, well, that's not what we need to do. However, when you're using it and you realize the perception of the students and the staff, you're going to see that shift. And in the next slide. All right, so staff that we used to select in terms of our pilot, we had taken the data that Angela had given us, and we used that to meet with them and to discuss, again, using the equipment based on their level of need and lost time due to injury. As you can see, some of our employees lost more than 2 months of being at work due to an injury based on a student. Next slide. The aspect that we want to build in is their self-confidence and feeling that they are supported, as I said before. So the question we had proposed to them when wearing PPE, do you feel you're able to manage these environments? Overwhelming majority said that, yes, I feel a lot more confident in my ability to effectuate what I need to do behavior management with the students. And also, when you come to work, you want to feel that you can go home without having to feel at risk. So the question, do you believe PPE may be able to resist and to assist any kind of prevention? Again, overwhelming majority out of the sample said yes, they feel that way. Next slide. Perfect. And again, our job as administration is to look to see how the staff feel that they are being supported by us. Once again, you can see, do you feel supported having access to the PPE as an option? Overwhelming majority said yes. One more note, sample of this came from all types of professionals, teachers, psychologists, social workers, teacher aides. So again, we took a sample of all walks of life within the education field. Next slide. You want to go over some of the numbers with that?
Sure. So as we took our first 4-month snapshot, we are seeing the amount of injuries being reduced, claims going down, especially those high-cost medical claims went from 29 down to 18. Definitely a reduction in record-only claims, and the types of claims that are caused directly by students struck or injured by a particular student. And now that we are further into the program, Matt has about a third or more of his staff wearing PPE because they've reached out since the pilot and said, I want to be safe. I see that this is making a difference. It really helps create a more positive environment in the school setting. It reduces substitute costs. There's so many added benefits from it that we are excited and continue to expand. For example, I think it was, well, yesterday or the day before, he had 27 more staff that said, I want the mouthpieces. So the company came back and scanned 27 more staff because they see the merits and the benefits of being safe at work. So they don't have to come in worried about, am I going to be injured? They can focus on the job that they're hired to do, which is educating students without having that layer of fear or apprehension.
Absolutely. Next slide. Okay, so again, PPE is part of the puzzle, and we say that in a sense that we want to keep the culture and morale high within a building, especially in challenging situations. So working with them, having them feel that they're recognized and that they are important. As we say to them, we hired you to do the job. We need you to be here for the students, and they recognize that, and that commitment level has certainly increased.
We've seen these added benefits, the increase of the staff morale, increases in special education staff retention rates, decreases in absenteeism, leading to lower substitute teacher costs.
Absolutely.
You know, RISE is very successful because PERMA comes in, we provide ongoing support, continuous monitoring. We're running very comprehensive data analysis of claims, not just here at Rosemary Kennedy, but in many buildings and in many districts throughout New York State, and then really tailoring the RISE program to the needs of the school, the BOCES, or a school district.
Okay. So, Angela, we're going to ask if anybody had written any questions at this time.
If you have any questions, please put them in the Q&A. And if you don't have questions now, but you have them later, we'll we'll email the contact information for Matt and Angela out to you. So just give you a couple of, a minute to put a question in case you have one. Just want to thank Matt and Angela for their time today. Oh, we do have a question. What about safety training such as CPI and others?
Absolutely. So we have a comprehensive plan to do that. So we use CPI and SKIP here at Rosemary Kennedy. We provide training sessions with that, with the proactive and reactive strategies that are vetted by the state of New York. We also integrate that in certain different, in other meetings as well about when to use the PPE at times. So we do situational based work. So for example, we provide scenarios, and an example that we give is that, say a staff member does not have the equipment on them at that point. Student starts to act out. Now in our program, we don't have anybody individually with that child at any time. So what we say is that the student would then, or the staff member would use the CPI technique to keep themselves safe. The other staff member would recognize that through communication, witnessing what's going on, get the gear on, step in, help out with the student at that time, while that other staff member gears up, comes back, works the child through the challenging situation, and keeps everybody safe at that time. That's just an example of what we do in terms of helping the staff recognize the benefits and application.
And PERMA will come in during superintendent's conference days. I come in myself, provide general safety training in the special education setting, what you should be wearing to work, what you should not be wearing to work, leave all of the jewelry off and at home. Hair should always be tied and pulled back to prevent hair pulls. Really kind of honing in on making those employees responsible for their own safety. And there's so many things they can do to keep themselves safe just by what they're wearing to work during each morning when they come to work.
Absolutely.
Is that ball cap ready for prime time? Can you show the ball cap as well?
So this one I just found out, and I found it fascinating. It fits me well. I have a rather large head, fits me very comfortably. Inside, and I'm not, with the lighting you can't see, but it's got the structure and fitting of a bicycle helmet. And
So if I give him a head blow, this is hard. You would never know that is
Probably hear
a
that.
hard surface,
Mhm.
but because it looks normal, and all of the things that we wear, the PPE, it's well received by students, and it's been really well received by parents as well. So this is an example of a new intervention. We are seeing a lot of head injuries, concussions caused by students that may throw an object, or when you're working with a student, just very spontaneously provide a head blow. This is going to keep that employee safe. And you could also tuck your hair up underneath it you're preventing also that hair pull. So we always are looking for the new and innovative. Our products that we recommend, like all of this PPE has been well piloted in school districts before it's released. So
yeah, and just to note that, Angela and PERMA have been fantastic. They've been listening to us. As we said, we had developed the idea of the mouth guard. We didn't know about the hat at this time because we're looking for something that's not going to be, again, something that is going to dissuade staff from using. Again, you're not going to walk in with a helmet on per se, just like in a sense that you would see in maybe at a construction site, or even put it on for a football helmet, but something that's more, I guess, acclimated to traditional wear.
it's not going to be extremely restrictive.
Correct.
And to a student, it's not going to be intimidating. And that you're trying to really find that balance, but yet keep that employee safe. A lot of all of these products are very, very breathable. They're extremely lightweight. So the employees are not feeling like, oh, I have to put all of this heavy gear on it. It's not like that at all. And it's very, very interchangeable.
And you can clean it often. Very easy to
It's all
clean.
washable.
Exactly.
Great. Well, thank you again. We'd love to thank our speakers. Thank you for joining us today, everyone. And we will make this recording available to all of the 56 districts of Nassau County. So thank you again. Have a great day.